Welcome to the Prescription for Admission podcast, where we talk about hospitals and hospital-based care, who you can expect to meet, and what you may experience during your time in the hospital, both as a patient and also as a healthcare provider working in a hospital. My name is Dr. Monique Nugent. I am a practicing hospitalist and also the author of Prescription for Admission, the book, where I talk about many of the same topics. Thank you for joining me and enjoy the show. Hi, and welcome back to another episode of the Prescription for Admission podcast. I am your host, Dr. Monique Nugent. I am a hospitalist, meaning I spend my time caring for patients in the hospital. And I'm also the author of the book, Prescription for Admission, where I talk about many of the same topics. And I'm also your only guest today. So while we're in between recording seasons 2 and 3, and I'm really proud of how season 1 came out, I thought I'd take some time, just chat with you by myself and talk about some topics that come up over and over again, either in my work with community groups or questions I get from friends and family or patients and other ways that people reach out to me. And so I thought I'd spend some time just kind of talking about myself and hit some really important topics while I spend my rest of my time doing really great interviews for season 2 and 3. So thanks for sticking around with me for today. Today's topic, it's a little bit basic, and I really wanted to start out with this because it's how I also started my book. And that's the discussion about hospitals and what type of hospitals that there are available and what's in your community and how you can find out what's in your community. So before we start talking specifically about the different types of hospitals, I really want to drive home why this is important. To me, it's extremely important that you spend some time learning about what hospitals are in your community available to you so that you understand the capability of each facility in case you need a hospital. So when I talk to people about being hospitalized, nobody is excited to be hospitalized, and I totally understand that. Oftentimes we find ourselves in the hospital due to an unforeseen circumstance or kind of a bit begrudgingly. You go to your primary care doctor, they say, oh, you really should go to the hospital, and you end up in the hospital. Most of the times people aren't really thinking about a choice. Unless you're someone who either has a complicated medical situation or a progressive disease process where you're coming into contact with physicians and hospitals a little bit more regularly, other people may not be thinking about those things. And people who do kind of live in that medicalized reality tend to have a system and a team that they rely on. And so you may immediately think, oh, I will go to my preferred hospital, which is X, Y, and Z. And that is my preferred hospital because that is where I get my care. That is where my specialist is. That is where I know they have the things that I need to be cared for. Other people who may show up in the emergency department may not have even once thought about what is in their community. So if we think about how we're taught to think about hospitals, when you watch TV or come across anything else about hospitals, particularly in the media, they spend a lot of time really lionizing these tertiary care centers, meaning places that have residents that do lots of research, that have a lot of things at their disposal. So if you're watching an episode of fill in the blank hospital show, like The Resident or everybody's favorite to talk about, Grey's Anatomy, they're immediately at that level. These shows start at a tertiary care center. And so we may think oh, that's where care happens. But in reality, not only is that not where a lot of care happens, that's not where a lot of people would prefer to be. Those centers tend to be in big city centers. People may not live there. They may have a hard time getting in and out. And people want to stay in their community. And community hospitals do a lot of work. And it's not just that people may want to stay in their community. People may want to stay at a hospital that cares for their need the best. So a pediatric hospital, not every tertiary care hospital has a full-blown pediatric wing. Again, like they show on movies and televisions. There are pediatric tertiary care centers that exist by themselves. There are pediatric hospitals that exist as a wing of or associated with another hospital, but there are pediatric hospitals that exist wholly by themselves to care for our children, which is a really specific population. And then also there are hospitals that care, again, for people who may have really specific needs, like cancers, or people who have really specific social needs, like our veterans. So just saying, oh, there's a hospital in my area, to me, that doesn't give you the idea of what is actually available and what you may need, if they can meet those needs, and how you may need to think ahead of time. So that's really what I wanted to touch base about today is hospitals. And I know that sounds like ultra basic, especially as a hospital inpatient-based podcast, but sometimes starting at the ground level is really key. And so what type of hospitals are there? When you think about hospitals, I want you to think from this may sound a little counterintuitive. People think like start from the ground up, but I think if people think top down, that is a little bit more how we're naturally taught to think about healthcare in this country. We're kind of taught that anything and everything can happen at a hospital, which is the top, which is the tertiary care center. So what is a tertiary care center? The tertiary care center is a place that has essentially all of the big research, and it has the teaching, it has the residents and the support, and it has all the big specialized care. It has special ICUs. It has ICUs, yes, but it may have a special ICU, like a surgical intensive care unit, a neurologic intensive care unit, a pediatric or a neonatology intensive care unit. It has all these really specific high needs things that people go to if they need a lot of intense care. So tertiary care centers, if you live in like a metro area that has several, that might be what's in your area. That might be the thing that you're used to thinking about and accessing. But for a lot of Americans, that's not the case. For a lot of Americans, to get to a tertiary care center, they kind of start somewhere else. And that somewhere else is a community-based hospital. And a community-based hospital is really kind of the lion's share of work that's going on. It's the place where people will say community cares for itself, neighbor caring for neighbor. They may have ties, financial and also administrative ties to other hospitals, like other tertiary care centers. A lot of, especially now, you're seeing a lot of big healthcare systems that have a tertiary care center, and then they also have smaller community-based hospitals that are able to tie into those tertiary care centers. And tertiary care centers are great places to get care, as are community hospitals. Community hospitals are also really great places to get care. You can do a lot of things at a community hospitals. I work at a community hospital right now. I have worked at community hospitals through my residency, and I have friends, who work at community hospitals around the country. And your community hospital can actually really be able to care for a lot of things. I don't want you to think immediately, if I'm having a heart attack, I have to go to the university center. If I'm having, if needing surgery, I have to go to the tertiary care center. That may not be the case. Take time to find out what's going on in your community hospital. What other organizations does your community hospital have ties to? They may have physicians from the tertiary care center who come and rotate and spend time there. They may have surgeons who come from the tertiary care center and come and spend time there and do procedures there, opening up access to those types of physicians and to those type of procedures in your community. Your community hospital might have a cath lab where they can care for acute heart attacks. So we call them MIs. They may have a place where they can care for acute strokes, right? They may have neurology on call and a neuroradiologist. They may have a neurosurgeon on call that allows them to be a higher level trauma center. So being a community hospital is not immediately like, pshaw, that's not a great place to get care. Or even those of us in healthcare think like it might not be a great place to work. It might be a really great place to work. They might be doing a lot of really strong care. They may be able to deliver a lot of really high level care, but they may not have everything. I think that's perfectly fair to say, hey, we are a community hospital. We have a cath lab. We have ICUs. We are able to dialysis. We have a neurosurgeon on call. So we are a higher level trauma center. We're able to deliver babies, we don't do fill in the blank, transplant. And that's okay. It's totally okay because the resources that are necessary for really complicated care are not only expensive and labor intensive, but they're very, very specialized. And to have the idea that every hospital is going to have access to this specialized care, these specialized type of equipment, these specialized professionals, and then be able to support you in the same way, because getting a procedure doesn't just stop when you go out of the OR, right? Now you make sure you have the right nurses who are able to care for you and the good rehab that knows what you can do and get you on the path to getting better. And so I think it's really okay that we have set up a system that says, hey, you, community hospital, you can do a lot of things and you can do a lot of things really well. And so we're going to say some of the more complicated things, some of the things that may require research and different types of supports that are harder to make sure every hospital in the country gets. We'll leave those with tertiary care centers. I think it's perfectly appropriate. And I want you to sit down and learn what's in your community. Again, what is your community hospital doing? And what does it have ties to? And what can you get there done safely, and what can't you get there done safely? So that's really important. And underneath community hospitals, that's where I think of really more specialized hospitals. I'm going to take pediatrics and put it a little bit to the side because pediatric care is, again, very specialized and needs people who know what they're doing, not just the physicians, but this whole social support network to care for our children. So I'm going to put pediatrics kind of to the side a little bit and think about hospitals that care for a bit more specialized populations, hospitals that care for our vets. I've mentioned that before. VA hospitals, I have again, trained at VA hospitals and have friends who work at VA hospitals. And a lot of really good care happens at VA hospitals. And a lot of people will prefer to be at their VA hospital. And that might kind of surprise some of our listeners because I know there's often a discussion around the veteran affair hospitals as being places where it's difficult to get care, difficult to access. And I never want to belittle that. I'm just speaking about the experience of what can happen inside a VA hospital. And so VA hospitals are really great places for people to get care because that system can really be built around the patient. Not only does the medical record at the VA hospital, if you're at a VA hospital in Chicago, they have access to the same medical record as if you're at a VA hospital somewhere in Arkansas, right? Not only do you have that great access to the medical record, which helps hugely with continuity of care, but a lot of VA hospitals can do a lot of really great things. And they can also kind of be set up in that same way as like have a community feel and then also have other VA hospitals that do much bigger, more complicated procedures. The VA hospital that I trained at in Loma Linda, California also had a nursing home associated with it. And that was a huge boon for us on the inpatient service because we knew that our patients always had a place to go. If they wanted to be able to go to a facility in the community, that was an option. But there were times where people weren't able to access those for lots of different reasons. And so having a place literally downstairs that they had access to, that we had access to, the other residents working there, we could call and give a good sign out. We rotated through. That to us felt like a real big safety net, a big win for our patients. And so if you are a vet or one of your loved ones is a vet, again, learn what the VA system has in your community and what it has to offer you. Other kind of specialized hospitals, there may be hospitals that specialize in different types of surgeries. I once covered a hospital that specialized in heart procedures, and there are hospitals that may specialize in orthopedic procedures. And those can be really specialized hospitals that people will have access to in different ways. You tend to go through that specialist, say like, oh, you're going to have X, Y, and Z done, so we can put you at this hospital that I work in and that I know has everything to care for this type of joint procedure. And I will say the patients who experience those types of hospitals tend to have, I think, a pretty good experience. I've met a lot of patients who have had those type of hospital stays. And I think it's a little bit different from the hospital stay, which is a little unexpected. These are people who have met with their specialists, sat down, made an appointment, and know what's going to happen here. Everything's been spoken to about them and kind of explained. But again, is that something that you have access to through your community? Is it available through your insurance? Does your insurance work with a physician who has access to one of those types of facilities? If you are looking to have that type of procedure done, and think about that. Think about if that is something that is an option to you. Now, the other type of hospital that I want to talk about that I think less and less people know about are hospitals that we find in areas that don't have a lot of care. Hospitals, they tend to be in rural areas, and we call those hospitals critical access hospitals, hospitals that are at a place where there's not a bunch of care and where people can access that hospital, and that hospital tends to be able to care for a lot more than people think, but, care for a lot of things. But if what it can't care for is stabilized and then transferred out. And critical access hospitals, I think, are a really important part of care in rural America. Particularly right now, we're seeing a lot of hospitals outside of cities and suburbs and, more rural areas starting to shut down for lots of reasons. And funding tends to be one of the major ones. And those people in those areas do not deserve any less care. Those people in those areas will not need any less care when those hospitals close down. In fact, what could be cared for is now not cared for, and you may see a bit of a change in what the community needs. And so if you are someone who lives in a rural area looking to see, is the hospital in my area a critical access hospital? And what does that mean exactly? How much can they care for before it's decided that we may need to be transferred to a different hospital? So now let's turn to the pediatric hospitals that I kind of put to the side. The reason why I put pediatric hospitals to the side is because a lot of different hospitals have the ability to care for children. And parents, just because you have a child doesn't mean that you should be forced to always look for a tertiary care center. A lot of community hospitals have built out their ability to care for patients and recruit nurses and physicians who can care for children. They may also have relationships with the children's hospital in the area. But the reason why I really put children's hospitals to the sides is because caring for children is not just getting smaller things. Caring for children isn't like caring for short adults. Their physiology is very different. Their needs, both physically and mentally, are very different at very different stages. And the way that we support children and their parents and their families and the whole support system to care for children really has to be addressed in a very comprehensive way. And so going to a children's hospital is a really very different experience than going to a hospital that may not cater towards children or may have a smaller children's section that isn't as comprehensive. In fact, I just spoke to a mother today who said, I didn't know that there was such a difference between a children's hospital and a hospital that was not specifically built around children until I went to both of them. I had experiences in both types of hospitals. And this is not to say that hospitals that are not specifically children's hospitals can't care for children. Again, I think I've said that before. A lot of community hospitals will have really strong partnerships with children's hospitals and pediatric services and pediatricians in the area to support their patients. And they may build out a NICU, a PICU, whatever it is, to care for those really sick children and be supported to do that. And when they do that, they tend to, again, have all those supports that I was talking about, the supports for families, supports for mental health, the supports for parents, the social supports that really go into caring for our children. And I really don't want parents to feel like if I have a child, I must end up at fill in the blank children's hospital, right? I'm in the Boston area, so Boston's Children's Hospital. I myself know that other hospitals have really strong connections to Boston Children's Hospital and work closely with them to support their patients. What I want parents to think about is learning what's in your community so that if you need something for your child, you know what you're walking into. So I've said a lot. I've said a lot, like, you need to learn what's in your community. You need to learn what's in your community, like over and over again. I've said that. And I've given you zero tools to learn about what's in your community. And so I'm going to take some time to do that now because I don't want you to just walk away and think like, oh, I just have to drive around or get a map and look and see what's in my community. There's a lot more organized way of going about this. So one of the things I want people to think about not only is like what's in my community, but what are the experiences and the outcomes of what's in my community. And so the two websites that I'm going to give you to really kind of spend some time delving into to learn what's in your community and what are the outcomes and what can they care for are, one is called from CMS, which is the Centers for Medicare and Medicaid Services. And that website is Care Compare. And the other website is from the Joint Commission. And I'm going to get into what the Joint Commission in a second, but that website is really just jointcommission.org. And the Care Compare website is medicare.gov and /care-compare. So let's start with the Care Compare website and why I really like this website. This website allows you to not just see hospitals that are in your area, but other types of healthcare organizations that can deliver care in your area. And then it also immediately gives you access to their 5-star rating that CMS does. So CMS, Centers for Medicare and Medicaid Services, takes a lot of data together and they say, this hospital does really well at X, Y, and Z. So they may look at something like pneumonia outcomes and say, how well does this hospital care for pneumonia? Like, how are their patients surviving? Are their patients coming back to the hospital? Is it costly to care for pneumonia at this hospital? And they take all that data together and they give it a star rating, 1, 2, 3, 4, 5 stars. The reason why I love the Care Compare website from CMS, which again is the medicare.gov website, is that it immediately gives you that information. You can look on the website and find hospitals, nursing homes, hospice centers, inpatient rehabilitation centers, long-term care hospitals, dialysis centers in your area. You put in your zip code, you click on the type of facility that you're looking for, and all the ones in your area will pop up, and immediately you see the number of stars that CMS has given it from its 5-star rating. And then underneath that is some star ratings from patient experiences. So I really love that website because it's very easy to drive. It's a little bit hard, I think, to find on their website, which again is medicare.gov. And then you have to go like /care-compare. But once you get into it, it's very easy to drive. And I love that it gives you more than hospitals because getting better doesn't just happen in the 4 or 5 days you're in the hospital. It happens days and days after as you're at a rehab facility or as you're getting dialysis or you're going to your primary care doctor and getting stronger. And then if you have a loved one who you need to support through hospice, that's not something that people have at the top of their head. A lot of people are not just thinking, oh, what hospices are in my area? We tend not to look for that unless we need it. And this is a great place to find access to information about all these different types of things in your area and a good way to learn. And I spent some time poking around on this website, looking at hospitals in areas that I've lived, hospitals in areas that I've never been to. And it really did have a really good coverage when I compared it to maps of those areas that I had never been to. I kind of pulled up maps because I'm a nerd like that and wanted to compare and make sure things are there. And it did a really good job. And I thought it was a really good way to get that information. We can talk about star ratings another day. And if that's really what you want to hear, leave a comment. But this will give you immediately access to the star ratings. Now, the second website I want you to think about is a website from the Joint Commission, which is just Joint Commission, Joint Commission, COMMISOSS, 2 S's, SSION.org. If you have not worked in hospitals, you probably don't know what the Joint Commission is or haven't heard about it or know it by its old name, which is JACO. So what is the Joint Commission? The Joint Commission is a nonprofit organization that sets standards for hospitals on how well they do things to be able to get certain accreditation. And getting accredited by the Joint Commission is required by CMS. So this is kind of, hospitals consider this, like, we've got to get this right. This is the baseline. We have got to meet the Joint Commission's expectations. And not only does their website have the ability to tell you all about their standards, which you should spend some time learning about, but it also gives you the ability to find out what hospitals in your area have been certified via the Joint Commission to care for different types of pathologies. What does that mean? I just said a lot. The Joint Commission, outside of setting a basic standard for hospitals to say, you're doing this well, you're not doing that well, we will give you a pass, we will not give you a pass. They also give these accreditations, these extra certifications, accreditations to hospitals to say, you have shown that you have the ability to care for strokes, to care for heart attacks. And so these really mean a lot because this means that the hospital has built out the infrastructure to care from you, what I like to say, from door to door, from when you show up in the emergency department thinking, oh, I think dad is having a stroke, his face isn't moving, his arm isn't moving, he's slurring his words, and all the way to discharge to say, oh, we've met with the neurologist, we had this type of medication given to us, we've met with the physical therapist, the speech therapist, we are set up to continue the next steps, we are set up for success. And so that's really important because you want to make sure that you are going to a hospital that is able to care for you if you need these really specialized care. And it tends to be just a stronger feeling of quality if you know you're going to a place that has built the services and has done this over and over again, has cared for acute MIs over and over and over again. And so check out the Joint Commission's website. And when you go to their website, if you go to certifications and click around there, you'll be able to find out which hospitals in your area have certifications for different levels of care for different specialties. The other thing that I haven't touched on, and I've kind of mentioned in passing, are trauma centers. So what are trauma centers? Trauma centers are hospitals that can care for patients who have had traumatic injuries and accidents, right? And the trauma center's designation goes from level 1, which is able to care for everything and has residents, it is doing research, and the American Association of Surgeons has gone through and said, College of Surgeons has gone through and said, yes, this hospital is able to care for these really complex surgical patients, again, from door to door, from the time they show up in the emergency department, and they've built out a whole system to care for them until they're ready to leave. All right. And that's level 1. All the way down, 1, 2, 3, 4, 5, to level 5 trauma centers. And those are centers that are really able to stabilize patients and then send them out and saying, hey, we can help patients get to a place and be safe. And then we'll send them to a place where a set of surgeons who are more able to care for these complex trauma needs will be. So again, don't think you have to live by or have to go to a level 1 trauma center. Level 2s and 3s trauma centers, in fact, level 3 trauma centers, that's where they don't have neurosurgical care. This is where there's a difference to say like, oh, we always have a neurosurgeon on board who's on call. That drops off at level 3. But level 2 and level 3s still do a lot of really great care and do a lot of heavy lifting when it comes to caring for patients who have had traumas. And traumas are not just like TV level trauma things happening with like, I don't know, big 9-car pileups and really horrific things occurring. Traumas are falls, right? And a lot of our elders will fall down and get pretty injured from a fall. And so don't think like, oh, that's also a thing that can't happen to me or my family. No, any of us can get injured and have an accident, but any of us can have a really traumatic accident, much more than you know or realize. And so those are really the things that I wanted to touch base on today when I think about hospitals and I talk to people about learning what's in their community. I say, like, number one, just find out what's in your community. Go to that website, the Care Compare from Medicare.gov, and put in your zip code, your town, whatever, and just see what hospitals are in my communities and what are their ratings. And then find out, what are those hospitals capable of caring for? Are they stroke centers? Do they have a cath lab? And those are things that you can, again, find out not just from Joint Commission, but the Joint Commission will tell you if they've gotten those accreditations. But also go to their website and spend some time clicking around and learning and seeing what they have. Hospitals are very excited to tell you what they're able to care for and what they can do for you. So spend some time on their website. The other thing I want you to do is talk to your primary care doctor and find out if there's a hospital that their practice is associated with or that they are able to have records from, because that will help, again, with that continuity of care if you need it. Learn what specialized hospitals are in your area. If you have a child, learn what children's hospitals and what hospitals associated with children's hospitals and have built out their ability to care for children's for children are in your area. And then also spend some time learning about the trauma centers in your area. And make sure that you know if this is a level 1 trauma center and if something, bad happens, would we be able to stay here? Or is this a lower level trauma center that they may be talking to us about transfer at some point in time because I might need specialized care? So that was a lot, especially to just hear my voice for the past half hour. And so I appreciate you sticking with me. I know that there's so much more to delve into. I know that I did not touch base on obstetrics. I will admit that I always feel a little bit uncomfortable speaking specifically about obstetrics. And so I want to invite one of my obstetrical colleagues to come and do an episode with me to talk about obstetrics in hospitals and how to find out what's in your area. And so please forgive me for leaving that out, but that, again, is why I did that. But I want to thank you for sticking around. Leave your comments underneath this episode to let me know what other things you want to know about hospitals, what type of hospitals there are in the areas, different areas, and how you access those hospitals. And always come back. Join me for another episode of the Prescription for Admission podcast. Don't forget to like and subscribe. And I'm working hard on season 2 and 3. Thank you guys so much. Have a good one. Bye-bye.